Nowadays, being able to handle soft tissues is what can make a difference between you and the crowd of people who practice surgery. It's surely a complex aspect in oral surgery, maybe the most complex one. Getting to the tissues full recovery, handling them correctly, certainly takes a very long learning curve. 3 technical aspects before starting to work in the right way. First, the blade must be changed at every step. It must always be very sharp. It must cut perfectly to avoid rippling the tissue and allow us to carry out half or full thicknesses cuts at our best. Besides, as soon as it touches a tooth or the underlying bone, the blade immediately loses its sharpening. So, for a surgery like the one you are watching, you need from 6 to 10 blades. Second, tweezers must be surgical and not anatomical. Not the one-tooth old-style surgical tweezers, but surgical tweezers like the ones you see here with more teeth, with wedge in the other breaks teeth. In this way, the tweezers manage to keep the flap still without too much pressure, distributing the stress on various parts of the flap. In this way, we won't damage the flap with one-tooth tweezers, but we'll have tweezers which grip effectively on the tissue. If we use anatomical tweezers, we'd have a slipping tool. Consequently, we wouldn't be able to keep the tissue still and to keep it in the right position. We should squash excessively, causing a compression trauma. Third and last point, oral surgery operations are often to be considered microsurgery operations, and as such they are to be performed with the help of enlargements. The operation you are watching was carried out with a surgical microscope, mostly to document the case through a video. Using a microscope is not necessarily required, however enlargements are essential. For instance, 3.5 binocular magnifying glasses are perfect. They are the ones surgeons use to perform this kind of surgery. Of course, without enlargement you can't think of properly suturing a connective tissue graft like this one with a 7-0 suture, or even properly and completely desepitalizing it. An important thing in the enlargement system is not only magnifying an image, but having a coaxial light, so your enlargement won't just need to have lenses to magnify, but also an effective light which must be coaxial to your line of sight, so that you have your operative field always perfectly well lightened. Even though I promised you 3 secrets, I want to give you one more. Surgery is like golf or boxing. If you don't practice, you won't improve and you won't become a good surgeon. So I want to particularly address to the youngest colleagues saying practice a lot of surgery. Do it a lot to become good and to be able to offer to your patients an outstanding operational quality. See you soon.